Artificial Intel Pros and Cons, a career guide navigated by Brian Ross and ChatGPT 29 to 1211 anesthesiologists. AI. Statement: AI can support anesthesiologists by helping review patient records, monitor vital signs, predict risk, support medication planning, organize surgical data, and improve operating room safety alerts. AI may assist with anesthesia monitoring systems, decision support tools, patient history review, scheduling, documentation, and quality control reporting. AI does not replace medical judgment, patient assessment, emergency response, medication responsibility, surgical teamwork, or physician accountability. This role may become more technology-supported as hospitals use advanced monitoring, predictive analytics, robotic surgery support, and electronic health record tools. Pros: anesthesiologists perform highly important medical work that supports surgery, pain control, emergency care, and patient safety. This role can offer strong earning potential, professional respect, advanced medical responsibility, and long-term career stability. The job builds elite skills in medicine, pharmacology, physiology, crisis management, communication, and operating room leadership. Experience can lead to careers in surgical anesthesia, pain medicine, critical care, hospital leadership, academic medicine, research, or medical administration. Cons: the career requires many years of education, medical school, residency, licensing, and ongoing training. The work can be high pressure because anesthesiologists manage unconscious or critically ill patients during serious procedures. Schedules may include nights, weekends, emergency calls, long shifts, and stressful operating room situations. Mistakes can have life-threatening consequences, so the role requires excellent judgment, precision, and emotional control. Bottom line: anesthesiologists are a strong fit for people who are highly disciplined, calm under pressure, science-focused, and committed to patient safety. This is a demanding but rewarding medical career for someone who wants advanced responsibility, strong professional value, and a critical role in surgery and pain management. Anesthesiologists 29 to 1211. Career guide: a strong anesthesiologist usually develops through pre-med education, medical school, residency training, clinical practice, licensing, board certification, and continuing medical education. Successful candidates are calm, precise, analytical, compassionate, and able to make fast decisions during high-risk medical situations. Experience in biology, chemistry, healthcare, research, patient care, emergency medicine, or hospital work can be helpful before medical training. SOC description: anesthesiologists are physicians who administer anesthesia, manage pain, monitor patients during surgery or procedures, and respond to medical changes before, during, and after anesthesia care. Common duties: evaluate patients before surgery or medical procedures. Review medical histories, allergies, medications, and risk factors. Create anesthesia plans based on patient needs and procedure type. Administer general, regional, or local anesthesia. Monitor vital signs, breathing, heart function, and patient condition. Adjust medications and anesthesia levels during procedures. Respond to emergencies or changes in patient condition. Manage pain before, during, and after procedures. Communicate with surgeons, nurses, patients, and care teams. Maintain medical records, safety documentation, and treatment notes. Core skills: medical judgment, patient assessment, anesthesia management, pharmacology, physiology, crisis response, communication, attention to detail, surgical teamwork, decision-making, pain management, calm under pressure. Qualifications: anesthesiologists must complete a bachelor's degree, medical school, residency training in anesthesiology, medical licensing, and often board certification. Some may complete fellowships in pain medicine, critical care, pediatric anesthesia, cardiac anesthesia, obstetric anesthesia, or other specialties. The role requires strong science preparation, clinical training, medical ethics, patient care experience, and continuing education. Licensing and certification requirements vary by state and employer. Characteristic traits: anesthesiologists must complete a bachelor's degree, medical school, residency training in anesthesiology, medical licensing, and often board certification. Some may complete fellowships in pain medicine, critical care, pediatric anesthesia, cardiac anesthesia, obstetric anesthesia, or other specialties. The role requires strong science preparation, clinical training, medical ethics, patient care experience, and continuing education. Licensing and certification requirements vary by state and employer. Resume template: your name, city, state, phone number, email address. Professional summary: patient-focused medical professional with interest in anesthesiology, surgical care, pain management, and patient safety. Skilled in clinical assessment, communication, medical documentation, teamwork, and calm decision-making in high-pressure healthcare environments. Core skills: anesthesia care support, pain management knowledge, clinical documentation, surgical team communication, medication safety, emergency response, medical ethics, critical thinking, patient safety education. Medical school name: Doctor of Medicine / Doctor of Osteopathic Medicine. Year: college or university name: bachelor's degree in major. Residency / fellowship residency program name: anesthesiology residency. Dates: fellowship name, if applicable. Specialty area: clinical experience. Role / rotation / position: hospital or medical center name: city, state. Evaluated patients before procedures and reviewed medical histories. Supported anesthesia planning, monitoring, and documentation. Communicated with surgeons, nurses, patients, and care teams. Responded calmly to changes in patient condition. Followed safety standards, clinical protocols, and medical ethics. Licenses / certifications: medical license, board certification, ACLS / BLS / PALS / other certifications. Additional experience: healthcare, surgery, emergency medicine, critical care, research, teaching, leadership, or hospital committee experience may be listed here. Cover letter template: dear hiring manager, I am applying for the anesthesiologist position. I am interested in this role because it combines advanced medicine, patient safety, surgical teamwork, pain management, and calm decision-making under pressure. I bring strong clinical judgment, communication skills, attention to detail, and commitment to safe patient care. I understand that anesthesiology requires careful assessment, accurate medication management, continuous monitoring, and the ability to respond quickly to changing patient conditions. I am prepared to support surgical teams, manage anesthesia care, communicate clearly with patients and medical staff, and maintain high standards of safety and professionalism. I would appreciate the opportunity to contribute to your organization with clinical skill, responsibility, and dedication to patient outcomes. Thank you for your time and consideration. Sincerely. Elevator pitch: I am interested in anesthesiology because I want a medical role where patient safety, precision, and calm decision-making are essential. I am focused, disciplined, and committed to careful clinical judgment. I would bring professionalism, communication, and strong responsibility to anesthesia care, surgical support, and pain management.